think that most surgeons try very hard to be Renaissance persons, not necessarily men, and really try to understand all of the different factors that play into that patient's health. And we do that because we recognize that all those things really matter. The details really do matter in how the patient ends up at the end of things. So I think throughout the care community of pediatric spine surgeons, you'll find a universal attitude toward trying to optimize the care of the patient. Who owns that responsibility is different in different settings. And in some settings where parents are particularly able, the reality is that the surgeon kind of leaves it up to the parent to get the patient ready for surgery. That's not optimal, but that's often the way it actually happens. In other places, the surgeon themselves takes upon themselves the responsibility of going and sorting things out. I think in the ideal situation, there's someone who has an overarching interest in it who can look after it. But it's very clear to the surgeon that how well those things are tuned up ahead of time greatly influences the outcome. There's also a lot that goes on in the surgery that influences the outcome, and I think that at least I think that blood loss has a great deal to do with how children do. So if you can go through a surgery and not have an excessive blood loss, the chances of having a shorter intensive care unit stay are greater. The more blood you lose, the more blood transfusions you need. The more transfusions you have, the more you get respiratory dysfunction just from the blood product that has to get filtered through the lungs, and it takes your respiratory status and makes it even worse. The length of the surgery probably affects what goes on. So if you can do a surgery in a shorter time rather than a longer time, it's probably better in the long run. But perhaps the biggest thing is the patient's inherent respiratory status, and particularly their ability to manage their own cough and secretions. So I think we have the most trouble with the patients who have difficulty with respiratory toilet and coughing, and we can predict a long stay for them. But if the patient can get through the surgery, get off of respiratory support quickly, then you have a good chance of a relatively complication-free outcome. If you linger in the surgery, have lots of blood loss, the patient has to remain on respiratory support for a long time, then we begin to get into a potential cascade of problems. The respiratory support engenders pneumonia, the pneumonia engenders infection in other places. The longer you are in intensive care, the more likely you are to get other things out of tune, if you will.